So the question is about national health, and let me talk about healthcare in general. We are, as I mentioned, one of the healthiest states in the country, but our healthcare costs are too high. As I talk with business people, their number one, maybe it's their number two concern. The number one concern is the workforce available? That's what they always want to know. Whether the workers are there with the skills and talents and qualifications necessary to fill the jobs. Because if the workers aren't there, everything else could be okay, but they're not going to be successful. I met with the CEO of a company from Massachusetts last week. He would like to be in New Hampshire by September and have hired 100 engineers. I mean, that's, and find a space for 50,000 square feet. That's a good problem, but he wants to make sure that the workers are available. And this is a large company, and ultimately they'll bring more people to New Hampshire. So that's the number one problem. The second is healthcare. Business people tell me all the time that their healthcare costs, and this is no surprise to you all, costs continue to rise. So consequently, they're being forced to reduce coverage for their employees, in some cases eliminate coverage for their employees, which again drives up the cost of healthcare, because then people are more likely to access the healthcare system when it's too late and go to emergency rooms of hospitals where it's more expensive. Healthcare costs in New Hampshire now are $10 billion. They're 18.5% of our gross state product. If we don't curtail that, the trajectory is such that it will get up to 22.5% of our state product, which will crowd out investments in other areas. Education is a good example. Economic development is another one. So we need to do something to control healthcare costs. In terms of what's going on nationally, you all know that there have been constitutional challenges to national health care reform as proposed by the president. It's now at the Supreme Court level. They expect that the Supreme Court will rule on some of these challenges by the fall, and then we'll see where it goes from there, whether the Supreme Court then opines on the constitutionality, either one way or the other, and then obviously we have the elections in November. So I think after November it will be more clear in terms of what's going to happen with national health care reform. I think there are some good things that have come out of the president's proposal. One of the things that we did in New Hampshire, even before national health care reform, is that we allowed young people to stay on their parents' health insurance plans up until age 26. Again, I've heard more positive comments about that. You know, young people, as you know, they're just getting started. They're looking for work. They're trying to get jobs. Some of these companies don't offer health insurance, or they don't offer health insurance right away. To let young people stay on their parents' plan, I think was something very, very good. And that is part of national health care reform as proposed by the president. Another important feature is not allowing insurance companies to discriminate against children with pre-existing conditions. And that's part of national health care reform. I worry about, on a national level, as I do the state level, that we're still not focused on controlling costs. And we need to control costs. Here in New Hampshire, if we just did, I told you it's $10 billion that we spend on healthcare, if we just did as well as the average of the top 10 states in terms of their healthcare costs, we would not only not continue to grow those healthcare costs, we would lower our healthcare costs by $1 billion, go from $10 billion to $9 billion. So we need to have more of a conscious effort with the decisions that we make to control and lower costs. So I worry that that's not being done as aggressively as it should be at the national level. There's a lot of uncertainty now. There's uncertainty in terms of exchanges. There's uncertainty in terms of some of the mandates. But as I said, I think the picture will be more clear after the next election and after the Supreme Court ruling. But it's an important issue.